is Instagram live session for Australian Dental Council exam. कैविटी प्रॉब्लम के लिए आपको डॉक्टर को विज़िट करना चाहिए और दिखाना चाहिए कि कैविटी क्यों है, कहाँ है, और उस अकॉर्डिंगली वो ट्रीट होगा. दिस इज़ नॉट अ डेंटल एजुकेशनल लाइफ. ये स्पेसिफ़िकली उन डेंटिस्ट के लिए है जो ऑस्ट्रेलिया जाना चाहते हैं और ऑस्ट्रेलिया प्रैक्टिस करना चाहते हैं. एक एजुकेशनल वीडियो है. तो इफ़ यू आर नॉट रिलेटेड टू डेंटिस्ट्री और इफ़ यू आर नॉट अ डेंटिस्ट, सो काइंडली you may leave if you want to leave this live session. आप लोगों के लिए फिर से इंशाल्लाह करेंगे. I'm waiting for more dentists to join so that we can start our session. So should we start? Or should we wait?
Let's wait for 2 minutes.
Okay guys, I think we should start. Hello Dr. Elena. This is Dr. Abir. She cleared her ADC exam in 2018, part 1, and then Corona hit us, and now she's waiting for part 2. But she was kind enough to provide all the resources for us, all the guidance for students who are applying for Australia or who are looking to apply for Australia. And this live session was one of the most requested live session out of all the other countries. तो आप लोग जहाँ भी ज़्यादातर इंडियन और पाकिस्तानी फॉलोअर्स हैं, और यूजुअली सारे लोग ऑस्ट्रेलिया जाना चाहते हैं फॉर सम रीज़न. तो अभी तो वहाँ बहुत हैवी लॉकडाउन चल रहा है ऑस्ट्रेलिया में, लेकिन होपफुली आफ्टर कोरोना ओपन हो जाएगा एंड देन यू विल बी एबल टू अप्लाई फॉर एडीसी एग्ज़ाम. तो मेरी नॉलेज बहुत कम है इस बारे में, सो आई लीव इट टू डॉक्टर अबीर टू डिस्क्राइब एवरीथिंग इन डिटेल और आप लोगों की हेल्प करें. ठीक है डॉक्टर जी? इंट्रोडक्शन ठीक था?
हाँ ठीक था.
थोड़ा और अच्छा ठीक.
और क्या बताना?
मतलब शी इज़ एन अमेजिंग टीचर. I thought I should mention that. ठीक है? अच्छा.
So I'm going to talk to you about the steps needed to in order to practice in Australia. So you need to do a licensing exam, which is collaborated with Australian Dental Council. So the Australian Dental Council conducts this exam. There are 3 parts to get the license for Australia to practice dentistry if you are an overseas graduate. So the first part is that it starts off with an initial assessment, which is basically you're going to be submitting some documents that they require in order for you to and you have to get them notarized. Then you send it to them, and they will check it over, and they will send you an email whether you are eligible to apply for the written examination or not. Usually you're eligible wherever you've studied dentistry. That's not an issue. You just need to get a proper notarization from where I got it done was from the High Court, because they need each and every detail of the person who notarizes. The fees for the initial assessment is $610. This is Australian dollars, not American dollars. And it takes 8 weeks for the ADC to get back to you. So you have to do it quite within a big time frame before the written examination application opens, so that you are eligible to apply for the written examination application. Now, recently they've introduced a renewal fees for the initial assessment. Usually it was valid for a lifetime. When I applied for it, they told me that it was going to be valid for a lifetime, but now it's only valid for 7 years. Which is okay. You should have enough time to do the ADC Part 1 exam and then do the Part 2 exam. Well within the time frame you'll be able to do it. But just in case you want to know, the initial assessment renewal fees is $250. They've just added that this year. After you've approved the initial assessment, you will apply for the written examination. You'll fill out a written examination form when the dates for the written examination open, and you will send that to ADC. This is all by post. You can't do it online. The initial assessment documents are also sent by post, and the written examination application is also sent by post. Once you have applied for the written examination, ADC will get back to you in about 4 to 6 weeks. Are you eligible? Are you not eligible? And if you are, then they'll tell you that you are, and they'll tell you what the next steps of the written examination process are. They'll tell you that Pearson VUE, which is what ADC delivers their exam through, it's a company in which ADC delivers their exam through, and it's spread all around the world. But it's not available in Pakistan for some reason. They'll tell you that they will send you an email, and you will have to book your exam through them. Then when there are about 8 weeks left in the exam, you will get an email from Pearson VUE. They will tell you to call whichever relevant center you want. Now, Pearson VUE has centers in India, in Dubai, Egypt, China, Australia, England. It's all written on their website. You can go and check it out for yourself. But it's not available in Pakistan, and there are only certain areas in these countries where it's available. Like in England, it's not available all over England. There are certain areas where it's available. In China, it's only available in Hong Kong. In Dubai, it's available. They have 5 centers, five different centers. The thing about this is that the centers get filled up really quickly. So you have to call as soon as the examination date. As soon as Pearson VUE sends an email to book the exam, you have to call them immediately. And you have to make sure that you book both the exams because the exam consists of 4 papers and it's over 2 days. So you have to make sure that you book both days at the same center. Because if you book one day, they'll ask you, are you going to book your second day? And you have to. If you don't, then you won't be eligible for the exam. After that, after you've booked your exam, they do give you a time period, about 4 weeks you have, if you want to change the venue in case something comes up. But after that, you won't be able to change the venue. Once you've booked your exam, then after 8 weeks, wherever you've booked your exam, you go and you give the exam. Now, what the exam consists of is, it's 4 papers. Paper 1, Paper 2, Paper 3, Paper 4. It's spread out over 2 days. Paper 1 and Paper 2 are on the first day, and Paper 3 and Paper 4 are on the second day. And they are, when I gave the exam, each exam was 3 hours each, and you had an hour break in between. But I think they've changed it now. They've decreased the time, the hour break as well as the time limit for the exam. It's MCQs. They're all MCQ based. It's 80 MCQs per paper. And first it was the 40 MCQs are just normal MCQs and 40 are scenario based, which is basically 8 scenario based, which have 5 following questions. But now they've made the paper more scenario based, so their focus is more on a clinical setup and more different scenarios that you can experience in dentistry and how you would follow through with that. The breakdown for each paper is different, but they do have questions from all over the place. So even if you have like a paper that focuses on prosthodontics only, you will be asked other questions from other areas as well. So you have to be fully prepared. You can't do that I'm only studying paper 1 and paper 2 today and I won't study anything from paper 3 and paper 4. You need to know everything. But ADC is it's very repetitive. So the examination, you'll have like repeated questions, and they might be a different scenario or they might change the name or something, but the exam is very repetitive, so it's not difficult to pass the exam. Once you've given the exam, expect your results in 4 to 6 weeks, and then the way they grade their exam is on percentile based. Basically, the smarter everyone is around you who's given the exam, the higher the percentile is, the more difficult it is to pass. So for example, if they give a paper that's very difficult, for example, if paper 1 was very difficult, the percentile will obviously drop because not a lot of people will have been able to pass the paper. But obviously they will pass some people. The percentage of passing the ADC exam is unfortunately not a lot, but it's a very doable exam. You have to be very smart about giving the exam. It's not about studying a lot like we did for our BDS. It's about knowing what to study. After you've passed your part 1 exam, then you can appear for your part 2 exam. Between the part 1 and part 2, you have a validity period of 3 years, and you need to make sure that you give your Part 2 exam in those 3 years, otherwise your Part 1 exam will expire and you unfortunately will have to go through the whole written exam process again. And then if that happens and if that fails as well, then you have to make sure your initial assessment is still intact while you prepare again. But it's not a difficult exam. You will pass the first round, and if not the first round, definitely the second round. People don't fail that often if they know what to study and how to study. The Part 2 exam is quite expensive. It costs $4,500, and it only takes place in Melbourne in the ADC Centre. It doesn't happen anywhere else in the world, so there's a lot of costs and stuff that you have to consider there. Anyway, back to the Part 1 exam. So the results are percentile based, and you'll get a grade ABC for each paper, and a C is pass as well. You don't have to worry about that. And they don't really focus on which grade you get. That's just something I think for their own records. They don't really care about that because that doesn't have any effect on your Part 2 exam or process, or whether you give it first or not. It doesn't matter. So that is the exam. That's the license exam. Afterwards, after you've passed both parts, when you have to register with them, they will ask you if how competent your English is. They have various clauses. It goes if you've done your secondary education from a recognized country, and then again they have different aspects of recognized country as well, like UK is a recognized country, New Zealand is a recognized country, stuff like that. Canada is a recognized country. If you've done your secondary education from there, you don't have to give an IELTS exam for your registration. If you haven't done your secondary education, then they look at your tertiary education and they ask, is that from a recognized country? Again, the same places. And if it isn't, then they ask, how long ago did you graduate? And if you graduated recently, they may ask you to give a certificate saying that your course, your BDS course was in English. They may accept it, they may not accept it. It depends on them. Then they have, obviously, if you don't fulfill any of these, then obviously they ask you to do the IELTS, or they have the TOEFL, or there's a PTE, or there is an OET. You can give any of these exams. It's all written on the ADC website. In fact, they direct you to the Dental Board of Australia website, which is where this is all, because that's who you're going to be registered with after you've given the ADC exam. Once you're registered, then you can practice in Australia as a general dentist, and you shouldn't have any trouble finding work because Australia needs dentists, especially in their suburb areas, in their urban areas, their regional areas. They need dentists. You might even easily get a job there, because I was looking at recent jobs that they need in Australia, job occupations that they need in Australia, and they do ask if you're a recent graduate of ADC, we will consider you. Obviously, these places are in regional areas, and you might find you've gone really far from the city, but they're still very, very pretty, and you still get a lot of money compared to a lot of places. Working in Australia as a dentist is very beneficial and quite fulfilling, and the best thing about it is it's not such a 9 to 9 kind of job. You can work your own hours, 9 to 5, 9 to 1, 1 to 5. It's your own hours, however much income you wish to earn. You can work 7 days a week, and so working in Australia is quite, you'll find it quite satisfying. Yeah, you'll find it quite satisfying. So there's no age limit to apply for the ADC exam either. You can be any age and you can apply. In fact, in one of my courses that I took, I had a 55-year-old dentist from Saudi Arabia. He barely understood the English language, but he had passed Part 1 and he was preparing for Part 2. So it's a very doable exam because there's a lot of repetition exam. So now I'm going to talk to you about the course that I'm starting.
Were there more questions that they asked?
There was
one question related to the academy or something.
There was a question. So Australia has a lot of academies in itself that prepare you for the ADC exam. There's an ADC. Usually these academies were for the Part 2 exam because you won't get much information about the Part 2 exam online and the way it's conducted and how you have to practice. Because if you're from an overseas country, it's very difficult to know how Australia wants you to practice and what they expect of you. So these academies are basically dentists who've passed the exam and who are then helping other dentists who want to pass the exam to practice and prepare for the exam. Recently, these academies, which were usually for part 2, have started a course for part 1. Part 1 is a written examination, so the academies in Australia are very good, but as good as they are, that's how expensive they are as well. And all the material any academy is providing is the same material that anyone else has who's prepared for the exam and has passed the exam. So I've decided, especially in this COVID, I was sitting around and thinking that I need to do something that I can help other future dentists, because when I was doing the exam, I didn't know where to look and how to prepare for the exam. So I decided that I want to be one of those people who can help future dentists who want to migrate to Australia and work in very good conditions. And so I prepared a course that will help in passing the Part 1 exam. The course that I'm conducting consists of 5 sessions, and it is at a very good nominal price, which you'll find much better than any of the Australian academies that are conducting courses. Obviously, they're all in Australia, so it's very easy for them to give the amount of money that they are asking for. But I understand the difficulties it is for people who are not living in Australia who want to give the exam, how difficult it is to get that amount of money. I mean, the exam money is so much anyway, but to pay a course fees on top of that, it just gets very financially burdensome. So the course I'm doing consists of 5 sessions. We go through all the papers, all the materials, all the MCQs that are required to that come in the exam, and 60% of those MCQs we already have them. The ADC might even make a paper which is 80% of all of from the MCQ bank, and sometimes my paper 3 was exactly the questions that I had in the MCQ bank. I didn't even need to look anywhere else. It was the same exact paper. Obviously, that is a disadvantage at some point because the percentile increases for that paper. But if you say have the questions and you have the answers, it's very easy to pass the exam. So, and along with that, we provide a mock exam as well, so you have a good feel about how you're doing and how you're getting along. ADC on their website has given a lot of material to study, and it's not necessary to study all of that material. They literally select things, select articles, select books that you need to study, and other than that, it's very easy to pass the ADC Part 1 exam. So the course that I'm doing, starting in a couple of weeks, inshallah, is it consists of the 5 sessions. It consists of all of this, a WhatsApp group in case you need to ask something. You can interact with others on the WhatsApp group who are taking the course as well to discuss and ask questions, or you can ask me as well, because I have all the correct answers that have been corrected over the years and that have been accepted when I've given the exam, the ADC exam, which is the reason that I've passed the exam. So, but if you have the money and you want to go for an Australian academy, then by all means go for an Australian academy. They're very good, and it's the same material everywhere actually. Some may charge more, some may charge less, but in the end it's the same material. There's nothing new, there's nothing extra that they're doing.
There was a question about Part 1.
The specialist one?
The FCP's Part 1, would that
so
hold any value in clearing ADC Part 1?
Right. So if you've given FCPS Part 1 here and you're then suddenly deciding to go to Australia, it doesn't convert over. It doesn't exempt you from Part 1 either. You'll still have to go and you'll still have to give the ADC Part 1 exam and Part 2 exam to get a license. Now, if there's a specialist that is applying, so the ADC doesn't really handle the specialist, the Dental Board of Australia does. So the Dental Board of Australia will determine, does this specialist need to give an exam or not? And if they do need to give an exam, they'll refer the person back to the ADC, and that person will have to give the same general dental exam. If the Dental Board of Australia feels like the person doesn't need to give an exam, then they can go ahead and register. But it depends on your specialization and the country of specialization. If they feel you do, they'll refer you back to the ADC and you go through this whole process that I've just explained to you. I think.
What about the other exemptions from ADC? Can a Pakistani or an Indian dentist in any way get exempted from this exam?
So far as my information is and all of that I've researched, you cannot get exempt from this examination. Someone from say England who's practicing in England, if they want to go to Australia, they may be able to be exempt from this exam, but it also then depends on if the ADC wants to look at their tertiary education. If their tertiary education, their BDS, is not from England, it's from somewhere else, there may be a chance that ADC wants them to give an examination. Then it's a possibility they might get exempt from part 1, but not from part 2. Any exemption would be from part 1, but it wouldn't be from part 2, because like I said, the way that Australia works clinically is very different from even England, I would say, because I've gone through the process, I've taken the course, and it's very, very, very different. So they need to make sure that the dentist that they are letting practice in the country actually practices up to their mark, which is quite high. The way we practice dentistry in Pakistan is definitely not the way they practice dentistry in Australia. They're very, their skills are very up to the mark, very polished, very refined, and the way they handle the patients is also very, you would say, very refined, very well done. Not like we do it here.
What about the cost?
The cost of
ADC exam, the whole process of
the whole
ADC.
process. So the exams itself and the initial assessment is $6,500 is the exam, both parts, part 1 and part 2, plus the initial assessment. So that's like $7,110.
No, but in total, what should we expect to pay? Like, how much money should a person have in his bank?
You should have, if you do it in Pakistani rupees, you should have about, because there's a lot of material and stuff that requires for the part 2 exam that you need to buy, and then most of the stuff isn't even available in Pakistan or in most countries. It's mostly from America or from Australia that you can get the stuff from. So a person should have a good 20 to 25 lakh in their balance, in their bank account balance, if they want to seriously pursue this exam. For those living in Australia, it's easier because they're living there. They can work as dental assistants and they can earn, and they're earning in Australian dollars. They don't have a visa problem. They don't have to get a flight. So it's very easy for them. Ones who are working abroad, like in the Gulf, I think it's even easier for them because they don't have a visa problem either. They can easily get a visa, and whatever they're earning at that time in their country is definitely much more what we earn here. So it's but for Pakistani, they need to have this much amount of money just to make sure that they can get through the whole process and not have to sit around waiting, because you don't really have that much time to wait around with the validity period and everything. What subjects are inclusive in part 1? So in part 1, the 4 papers, I can go through the papers and the subjects that it's divided in. So paper 1 is operative, dental materials, dental caries, endodontics, dental pulp, and tooth conservation. This is paper 1. Paper 2 is fixed prosthodontics, removable prosthodontics, and implantology. Paper 3 is anesthesia, infection control, medicine and surgery, oral maxillofacial surgery, pharmacology, oral pathology, and oral medicine. And paper 4 is orthodontics, the public dental health, pediatric dentistry, periodontics, preventive dentistry, and radiology. So it's all clinical exam. There's no anatomy, there's no physiology, there's no biochemistry. Of course, there's pharmacology, but that's also related to clinical pharmacology. It's not anything else. I mean, we studied a lot in our bachelor's degree, but this is all clinical. Any other questions? Let me just go through this that I might have missed.
There was some question about how important is it to take a course for ADC. Like,
Important.
someone asked, like, is
So
it really important for
Yeah.
someone who has
So
low
the
budget?
problem with ADC is, it's they have this saying for ADC. Everyone says it: study smart, not hard. The problem with us Pakistanis is we study hard, but we don't know what studying smart means. I've known a lot of people who've not taken the course and they've not been able to pass the exam because they don't know how to study for the exam. And there are very less people who have passed without taking a course. Very less, very less. A lot of people, they need to take a course because that course provider gives them those MCQs that are needed in order to pass the exam. And you don't get those MCQs online anywhere. You actually need them. Only course providers give those MCQs. So the course that I'm doing has those MCQs. It has a lot of MCQs that came in my own exam, so I can relate really well how important those MCQs are to pass the exam. Is one supposed to give it only after graduation? Yes, you cannot give the exam until you have completed your BDS degree because they need to see your degree certificate as well. It's one of the things that need to be notarized when you send in your initial assessment. So you need to have a full BDS degree in order to give the part 1, in order to give the ADC exam.
Any more questions?
Yeah, any more questions about the ADC exam? Shall we wait a few minutes?
Yeah.
Okay. So, are you thinking of giving the ADC exam, Dr. Harris?
No, I don't like Australia that much.
Oh, but you've never been, so you can't really say.
Yeah, but I don't want to practice dentistry there.
Oh,
I might come visit you and party and stuff, but I don't think.
I'm pretty sure once you go there, you'd want to stay there.
Really?
Yes. It's a very nice, friendly environment. The people are very friendly.
Yeah, I love Australian people, but it's too far away from Pakistan, and
What does
this is one reason that I would not want to stay that far away from my home country. And
why not?
there are many reasons too, but the heart wants what it wants.
Okay, we have another question. Does electives or internship play a part in consideration by ADC? Electives or internship, like as in house job?
Yeah.
No, it doesn't. I mean, like, they do need some practical experience. So you some postgraduate practical experience. In a way, you can say that you do need some practical experience in order to apply for the ADC exam, but you don't need to do any certain electives or anything to apply for the exam. If you've done some extra CPD, you can mention those as well. And if you haven't practiced any dentistry after graduation, they'll ask you for a reason why you haven't practiced dentistry and what you've been doing in the meantime. But it's not a necessity to do any kind of electives, but you do need to have practical experience, and the one that you have in your third year and in your final year, that also counts. So they will ask you how much total hours that was.
But I think no one should skip the house job
It's
or
very
internship,
important,
because
yeah.
even for job applications it would help you.
It would definitely help you, because while you're waiting for the ADC exam, you should definitely be continuing on with your health job here. You shouldn't just leave it and just give the ADC exam, because it's not something that you can do part 1 and part 2 instantly. You need the experience. Plus, if you haven't clinically done any experience, it will be very difficult for you to do the part 2 exam as well. I hope that answers your question.
Total time span required for both parts, ideal.
Well, ideally, you should be done within the 3 years of your part 1 validity period. Some people have finished their ADC exam within 6 months of each other. They've given the part 1 exam, and within 6 months they've cleared the part 2 exam. But if you're asking how much time is required for each part to study, so for ADC part 1, I would say you need about 4 months to prepare for the exam, and for ADC part 2, you need about 6 months to prepare for the exam, because that is a lot of clinical work that you need to. It's like a new learning that you have to do from what you already know. It's like forgetting everything you know and starting anew, the way Australia wants you to study. Electives as an experience in any other institute or extracurricular practice in the Australian industry. No, it's not necessary to have extracurricular practice in Australian Institute, but you need to have some practical hours, so they know that you know how to practice dentistry. This is not that as soon as you graduate, you giving the exam, you're going to Australia. You need to have some practical hours. So I would definitely say that it's very important that you do the house job. It's for your own experience as well. I hope that answered your question. You don't need to have any specific experience. You need to have like a general experience in dentistry for the ADC exam.
Any more questions?
So
should we wrap it up?
Yeah, I think so. If you have any more questions and you haven't been able to answer them, please DM me on Dr. Bir Kazi. That's my Instagram professional account, and I would be happy to answer any questions that you have about ADC exam, part 1 or part 2, anything. What do you think?
That's it.
Yep. Okay. Bye. Thank you guys for listening. Bye.